Did you know that hypertension can be treated naturally without medication? Stay until the end of this video and you will learn the secret on how to treat hypertension naturally. My name is Dr. Cooper Dogry. Welcome to my channel. My channel was started a couple years ago, but now I'm activating the channel because I want to impact more lives. So if you haven't subscribed yet, go ahead and subscribe. So what am I going to be doing? I'm going to be making a red smoothie. Yes, red smoothie. I know you've heard about green smoothie and how impactful the green smoothies are. But listen, this is going to be a red smoothie to lower your blood pressure naturally. Here are the things I'm going to be using. Watermelon. This is big and heavy. I'm going to try to cut it. All right, so with the watermelon has diuretic properties. As doctors, we treat high blood pressure with medication called diuretics. What these medications do, they increase your urine flow to the kidney, increase urine secretion, and therefore impact your blood volume, lowering the blood volume, and therefore lowering the blood pressure. Here as well, we have potassium, a high potassium diet, and high potassium if you have normal kidneys. High potassium or enough potassium will lower your blood pressure. Potassium has the reverse effect of sodium. You know that with sodium tends to increase the blood pressure. Water follows salt, and therefore increased volume can increase blood pressure. But here we have more potassium in this watermelon. So what I'm going to be doing, I'm going to add a portion of this watermelon to this blender. So let me take a portion out. And you're going to be making a red smoothie. This is seedless watermelon. So I'm adding all of this. This is a portion. After that, I'm going to be adding celery. You must have heard about celery juice and the effect that celery has on blood pressure. Celery also has a diuretic effect. Celery also has vitamins, potassium. Celery has good fiber. Celery is good to lower the blood pressure. Now, let's look at these berries. These are strawberries. I'm using 1 serving, which it's about 8 of these medium-sized strawberries. That's a serving. We're adding even the leaves. Here we have increased potassium, increased magnesium. We have antioxidant. All of this will impact the blood pressure. These are gonna cause the blood vessel to be more flexible. So therefore we have dilatation and then the blood pressure will fall. Now, this is magical. You can't have a red smoothie without beets. Why do we like to add beet here for hypertension? And you want also to use some of the skin. So you're not going to peel all of it. You're going to take some of this off. This was already washed. So I'm taking some of the skin off and I'm going to use everything here in the smoothie. So beet has vitamin A, vitamin C, vitamin K, vitamin B. Vitamin B is good for memory. So if you want to stay away from Alzheimer's, add beets. These are also good for anemia. So we have nitrites here. Nitrites, which converts into nitric oxide. Nitric oxide is a vasodilatator. It will dilate and widen your blood vessel and therefore lower your blood pressure. You can't have a red smoothie without beets. So if you have hypertension, ensure that beets are added to your smoothie. And then I'm going to add cucumber. This is fantastic as well. You have a high concentration of water here. More water will decrease blood pressure because dehydration can cause hypertension. So, and here also you have more fiber, which helps to decrease inflammation and atherosclerosis. You have here potassium and all your vitamins. All right, now you may be wondering, so what are you going to put here to liquefy? This is the magic. This is hibiscus tea. Now, I'm going to show you what hibiscus look like. Hibiscus is a flower, and scientists have shown that using this as a tea, drinking a glass of hibiscus tea twice a day for 2 weeks can lower your systolic blood pressure by 20 points. So if I'm going to make a smoothie to lower blood pressure, then I must add hibiscus tea. You may be wondering, so how do you make the tea? So you get a pot of water, put the pot on, you're going to boil the water. You're going to do, say, 5 cups of water to 1 cup of these florets. Cover that, bring it to a boil, and then turn off the heat. Let it cool, and then you can have that twice a day, 1 glass, for the rest of your life, and that will have a significant effect on your blood pressure. So now we're going to add this. All right, I'm just going to start. I want to make this as thick as I can, and you can make the thickness. You can also freeze the vegetables like the strawberries. Freeze that and it will change the thickness of your smoothie. So let's make the smoothie now. One other very important fruit that you may add, and you can add it frozen, it's the ripe banana. We know that we have a lot of potassium here, and potassium is good to lower blood pressure. High potassium food. Another thing we could add here, just some extra spinach and kale. That's also very effective because of the high content of potassium as well as nitric oxide. Now, if you have kidney disease, you have to be very careful with high potassium foods. All right, so now we're going to blend. And let's see what we have here. Now, this is our red smoothie for hypertension, filled with a lot of vitamin A, vitamin B, vitamin C, antioxidant, nitric oxide to dilate blood vessel. We have the hibiscus tea, has the effect of angiotensin converting enzyme inhibitor. These inhibitors we use naturally for hypertension. So patients with hypertension may come to the doctor. We give them captopril, benazepril, and enalapril. The hibiscus tea has the same effect to vasodilate the vessels, make the vessels a little more flexible, and therefore lowering the blood pressure. I'm going to taste this. It looks delicious. Let's try it. Delicious. You need to make this today and drink this every morning. If you have high blood pressure, work along with your doctor, and your doctor may be able to lower your blood pressure medication or even to get you off medication entirely. I'm Dr. Cooper Dockery. Follow me for more.